Hi everyone, I'm here with one of our patients,
Peggy.
and we were just going to do a quick little testimonial about kind of Peggy's
Back surgery.
story. Yeah, so.
Back surgery. I came from Knoxville, moved up here, fell on ice, and went to the doctor there, and I was in just like aching pain in my back, and then they told me I needed spine surgery. Had the spine surgery, and my life turned to hell. And I was hurt and I wasn't walking straight. My leg went numb on me, and I was in a lot of pain down all the way down to my foot. It's a sciatic nerve there, and I was leaking out of my back for 5 weeks, yellow stuff. And home health care nurse tried to get hold of the doctor, and he wouldn't reciprocate, from my understanding. And so then I go see the doctor, and he said, "Well, you got to have another surgery. You got staph infection." And I was leaking like I was wearing a diaper on my back. So and then I got opened up again. I don't understand what he did. They don't tell you. And so then I got sewed back up, went to transitional care, another nightmare. They wouldn't help me up out of bed. Anyway, so that was in 21. So I had surgery February of 21, April 21 to irrigate the staph infection. Then I go home and I'm not walking right. My leg is numb. I'm in severe pain, getting injections, and then I met Dr. Perez. He was in Stillwater. He said, "I can do another surgery on you," and he took out, don't quote me, he took out the screws and put new ones in, put a rod in there, and he put a spacer in there. I am walking straight, but my legs are still numb from the first surgery, and I wish I would have found a good chiropractor like I am going to right now before the surgery, because I wouldn't have had to have the surgery. I wouldn't have had to have it because, they're wonderful, and never ever have back surgery. Always see the chiropractor first, because they can, when you fall like that, your muscles get tight, and your muscles get tight, and that's what happens, and then you're like compressed. And when you see the chiropractor, go on the roller bed, it stretches it, it kneads your back, stretches it up, you get stents on your back to relax the muscle, and voila, you're all right. You don't need back surgery no more. So now I'm suffering with my legs numb, and I wish I would have never had the surgery. Never.
Yeah, always try something conservative first, right?
Yeah, seeing a chiropractor first, because injections and pills and all that, they're not the answer. I've had an injection just lately. It didn't do nothing for me.
Mm-hmm.
And so now he wants me to go to the pain clinic and more injections.
Yeah, we'll pay for that, but yeah, right?
So the chiropractor, I'm working with them to get my leg better, because I don't like walking on it because it's numb. It hurts.
Yeah.
It just stings. It hurts, and your butt hurts, and your leg hurts. And then you get a lot of leg cramps. I've had a lot of leg cramps, and they don't feel so good.
Yeah. Well, we're glad you're here, because we got to do better, right? Yeah.
Yes.
Everybody's going to have some sort of history with their back. Sometimes it's just genetic. Sometimes it's incidental, like you had a slip or a fall or a car accident. But that's kind of, now we just got to move forward and
try to get the leg numb, and that's my biggest thing. But Dr. Perez did straighten the screws up right, but my leg is still numb from the first surgery. I got a lot of problems with it. I get a lot of inflammation. I get hot back there. Isn't that inflammation? It gets hot. Yep. And then I have a hard time getting up, standing, and I never had that problem. I was walking up 18 steps to my apartment in Knoxville, Tennessee. Yep. That's where I lived before. 18 steps, now I can't even walk up. Now I can't walk up a couple.
Yeah.
So.
All right.
That's my testimony.
Well, thank you. Yeah, last back surgery was in February. And
just the last surgery was in February. And I finally found a chiropractor, and she was on my Facebook. She was on my Facebook for nerve problems. Yeah. And I'm like, nerve problems? Hey, all right.
Right. Yeah. Well, we're glad you're here.
Yeah.
Okay.
And anybody out there, go see the chiropractor before back surgery. Yeah. From a fall, from anything. And see Dr. Perez if you actually need a back surgery.
There you go. Yeah. There's definitely time and place, and we have to send out for surgical referrals all the time. and, you know,
Yes.
ideally treat conservatively, but yeah, there is a time and a place.
Yeah, there's a
Yeah.
time and a place there, and after I had to correct everything
Yep.
and stuff like that. So
Well,
that's
thank
my
you.
testimony.
Yeah, thank you very much.
And have a good weekend.
Yeah.